For years, Kenya has been battling the fight against malaria. In October 7, Dr. Khadija Kasachun, Principal Secretary of Ministry of Health, launched a revised malaria strategy 2009 to 2018, which indicated that malaria deaths in the country has gone down drastically. So I decided to journey all the way to the Dadaab refugee camp to see how the refugees are protecting themselves from malaria infection. Born in an unforgiving environment, Hiretho Ahmed is taking care of her just-born grandchild in MSF Hospital, the Gahale Dadaab refugee camp. Hiretho is just amongst close to 600,000 people who are being hosted in the Dadaab refugee camp from Somalia after a civil war that broke in 1991, according to the statistics of Department of the Refugee Affairs, DRA. Hiretho tells me she made sure her daughter slept under treated mosquito net when she was pregnant to be safe from malaria, and also her entire family used treated mosquito nets for protection against malaria, despite Dadaab being a free zone malaria. Dr. Abdul Malik Wanyama, Medical Director of MSF Hospital in Dadaab Dagahale camp, tells me malaria is not such a big deal in Dadaab refugee camp. Like a month can go by without any malaria case being reported because of some major steps taken, such as distribution of nets and giving pregnant women treated mosquito net.
We have had a few cases of malaria. Basically, these are cases of patients who are migrating into the region. Normally, the traditional resident patients don't have malaria. This is basically it's a malaria-free zone. But what happens is you may get refugees coming in from Somalia and they have malaria. You can get refugees coming in from people coming in from Western Kenya. Sometimes also we recorded the statistics of a person who came from Southern Africa who had malaria last year. So far in the last 3 months we've only had 2 cases of confirmed malaria. This was a mother and her child. Prior to that also it was a similar statistic, and one was a patient who had come in from Somalia, and the other one was a person who had been residing in the camp, but with close proximity to the same person. So malaria is not a common illness in our setup. Nevertheless, we treat it quite seriously when the cases present. One is that we notify the government and the UNHCR authorities, because this is a notifiable disease. Number 2, we ensure that the patients are admitted and they're given the necessary intravenous and oral drugs to take. As soon as we realize that the disease has been treated after 3 days of review by our doctors, we are able to discharge back home. But then also we have an active surveillance system. Patients being seen in the health post, also in the hospital, they are routinely checked for malaria, so that to ensure that we don't have cases of malaria within the community going unchecked or untreated.
Ifo1 main camp, Islamic Relief, the agency in charge of health provision at the camp, handled similar situation as the ones experienced at Dagahali's MSF. A lab technician at Islamic Relief Hospital tells me the same thing. Malaria is not such a big deal at their hospital. Out of 100 plus tests done, only less than 10 were found to be malaria positive, and it was because those found with malaria were refugees from neighboring country, but the situation is always contained immediately.
It depends on our patients. These people are here for the last 20-something years. Most of them are prone to these things, but the ones who normally get close to this, they normally come close to them.
In the same hospital, because the malaria rate is so low, pregnant women had to be taken out of malaria chemoprophylaxis, which is always given to pregnant women to protect them from malaria infection in malaria endemic areas.
Mothers who are pregnant in other places, they are given anti-malaria during pregnancy. But here we don't do that. What we normally do, we just give them nets to cover themselves. Apart from that,
we have mosquitoes within the community. Usually they may not transmit the malaria parasite, but it's still important to guard between the mosquitoes, human transmission. As much as they may not transmit malaria routinely, they have been known to transmit other things like viral, hemorrhagic viruses. So usually we ensure that patients who access the hospital as part of the package for discharge, and also during some of our health campaigns, we are able to actually distribute mosquito nets for use by the community. So we promote the use of the mosquito nets, but also be able to actually distribute some mosquito nets.
MSF Dagahali Hospital is always busy tending to refugees and non-refugees from Wajir West.
In a month, usually we have admissions ranging between 550 to, sometimes it has gone as high as 1200, like what we saw in April. And in a quarter, you can translate that into a figure ranging somewhere between 1600 and 2200. So it's quite a busy facility. The hospital, in its kind of plan and in the model, we actually cater for all kinds of clients, especially pregnant mothers and small children. They're able to access our services at the ANC and postnatal clinic, which is situated in the hospital, very central. And then also we have the feeding center for the small children with malnutrition. We also have an outpatient center that caters for children with epilepsy or any kind of mental health. We understand the stigma, but this has not prevented us from making the facility accessible to those who benefit from these services. The hospital has an emergency department. As much as we focus on emergency cases, any person who comes and accesses the facility, don't turn them away, we are able to see them. But mostly the core of MSF activities in terms of primary health care is situated in the health posts. We have 2 health posts currently running, and they're able to access all the blocks in the hospital, in the camp. And basically what happens is that the day cases are usually seen there, but half of the hospital admissions are actually coming from these facilities.
Despite malaria not being a big deal in Dadaab refugee camp, other refugees fleeing their home risk bringing malaria into the camp. That's why different agencies and health practitioners from the camp take drastic measures to ensure refugees in the camp are safe. Recent malaria study had shown that a drug-resistant malaria parasite found in Southeast Asia could infect mosquito species in Africa. But Dr. Malik is confident that with proper measures put in place, Africa will be safe from the malaria infection.
It's a well-known fact that the malaria parasite from Asia is very resistant to Artemisia derivatives, which is the cutting-edge drugs used to treat malaria, especially falciparum malaria. This resistance has been limited to Asia and some parts of Australia, but now that the risk may be spreading to Africa, now what happens is, first, the most important thing in the fight against malaria is the awareness of the public. So we may actually, as MSF, we seek to promote public awareness of the same, but it should be done in a way where we don't promote panic. So one thing to be sure is the signs of malaria, the public needs to be well aware of the signs of malaria. It can be something as simple as a headache with fever and general muscle pain and joint pains. So long as someone is having these signs, we actually request for anyone with these kinds of symptoms to present themselves to the nearest health facility to get checked. We have the rapid test, which is it's very sensitive and it's well spread out and it's cheap to operate. So you'll find most health facilities are actually using it now in Kenya. And we are able to detect the malaria parasite up to a high percentage. It's sensitive up to a high percentage. So in case, just with an active surveillance system, I think it will be easy for us to detect whether or not we are actually having an increase in the prevalence of malaria in the community. So that will be one of the most effective ways with which we can actually monitor the resistance to malaria and the spread. Another thing is that for patients who've been treated before, we should be able to check maybe a week or a few weeks after treatment and be able to tell whether or not the drugs have been effective. So far, what we've seen is that the drugs are pretty much very effective in the treatment of malaria.
Malaria is the leading cause of maternal morbidity worldwide and leads to poor birth. That is why pregnant women living in the Dadaab refugee camp are screened for malaria during antenatal visit, among other diseases. Even with the rate of malaria infection going down, people are still asked to sleep under treated mosquito net. Reporting for Islamia TV, I'm Malasen Abdullahi.